Have a blessed day, Mom and Sir. I am Hannie Rellon from BSN 3. And now I'm going to perform my return demonstration on catheterization. But first, I'm going to explain what is the urinary catheterization. So, it is a procedure used to drain the bladder and collect the urine. This is through flexible tube called a catheter. Urinary catheters are usually inserted by doctors or nurses in a hospital or community. It is usually done when people have difficulty peeing or urinating naturally. So we nurses or the doctor can help the patient, and this is used to empty the bladder before or after the surgery and to help also the patient to perform certain tests using a urine. So, without further ado, let's start! So now I'm going to check the doctor's order. So here I'm going to determine whether the procedure is a straight or indwelling catheterization. So when we say straight catheter, it is also known as non-indwelling catheter. So these are used when the patient only has to be catheterized once, but they still under sterile technique. But they don't stay under the body after the bladder is drained. They are not connected to the collection system, but instead, it is drained directly into the basin. And many people self-catheterize at home using a straight catheter. So, however, indwelling catheter are placed under the sterile condition, which has a balloon at the end of the catheter, and it is to ensure that it is safe and stay inside the bladder. So they are used when the patient will need a catheterization for several days. And the most common type of indwelling catheter is a Foley catheter. So it comes in various sizes, which is measured in French system. So aside from that, I'm also going to determine whether the urine specimen is needed, the name of the patient, and the other doctor's order. So after checking the doctor's order, I'm going to wash my hands. This is very essential in nurses because it protects patients and other healthcare staff. And we also clean our hands to prevent the spread of microorganisms and illnesses that causes disease and infection. So we must wash our hands to minimize the number of microorganisms and to prevent any infections. So let's start. So now I'm going to wash my hands in order to reduce the number of microorganisms and also to prevent any possible infection that makuha sa patient gikan sa ako as a nurse. So let's start. So after washing my hands, I'm going to select the specific type and size of catheter to be used. So in the doctor's order, it is an indwelling catheter. So now I'm going to get the Foley catheter. So I have here a Foley catheter, which is a latex silicone coated. So this is Foley catheter sizes French 14. So I'm going to get this for our patient. And now I'm going to gather the equipments needed for the urine catheterization. So for the equipments, I prepared already my equipments needed. So I have here a cotton ball, surgical gloves, Foley catheter, drainage bag, waste receptacle, betadine solution, easy lubricating jelly, a drape for the patient, which as I prepare it and maintain the sterility of the drape, and kidney basin, medicine tray, and also a Kelly forceps tray. So now let's start and meet the patient.
Dayon! May buntag, sir. Buntag, nurse.
Hello, sir. I am Hannie Rellon, sir, from Brokenshire College of Davao. Pwede na akong mabala na yung pangalan, sir?
Hindi socials.
Okay, sir. So, sir, pila na gani mong edad?
33.
33. Kano sa birthday, sir?
August 29, 1987.
Okay. So, sir, na ako diri, sir, kay naay order si Doc na mag-perform daw ko og urinary catheterization sa imuha. Ang urinary catheterization, sir, kay mauna ang procedure para makaihi ka kay since maglisod mo pag-ihi o dili ka paadto sa CR na mangihi ka naturally. So, kami, sir, nagagamit mi og mga catheter para tabangan ka na makaihi, bisan naa lang ka diri sa imong bed. Okay lang sa imong, sir? Sige, magpadayon ko, sir, ha? Sirad-an lang ako ang curtain, sir, to provide privacy. Okay. Dala na ako, sir.
Hello, sir. Humana pa kagligo, sir?
Yes, ma'am.
Sige, sir.
Sir, i-position ka into supine position, sir. Okay lang sa inyo, sir?
Okay lang.
So, baon ako ni unlan, sir, or mas prefer ni mo walay unlan?
Kuha na.
Baon, sige, sir. Sir, tarong mo lang ako ni mong manong, sir, ha? Plaster lang na ako, sir. Sir, i-extend lang na ito itong tiin. Yeah, slightly bend na lang po ang tuhod, sir. Slight lang, sir. Slight lang. Sige, sir. Extend lang, sir. Bilang gamay, sir. Yeah, sir. So, sir, i-prepare lang ako ang gamit, sir, ha? So, now, I'm going to open the surgical gloves and wear the sterile gloves. So I'm just going to touch the side, each side, to maintain the sterility of the gloves. So, karon ibutang na nako ang diaper sa patient. So, karon, sir, ibutang na nako ang diaper, sir, ha? Sir, pwede mo ang sakang gamay mong lubot, sir. Sige, sir. Thank you. Then, this one. So, karon ipa-open ako sa kung kauban na nurse ang lubricant na easy lubricant jelly and ibutang sa kidney basin. Can you open this one, please? Thank you. Then, I will put it on the kidney basin. So, I'm using my non-dominant hand. And discard. So, this is now a not sterile while this dominant hand of mine is still sterile. Sunod karon, ibutang na sad nako ang second drape sa patient to provide privacy and sterility sa penis sa patient. This is to provide sterility to the patient. In the next one, I'm going to ready the catheter on the sterile field. So now I'm going to open the catheter and maintain the sterility of it. I'm going to get it. So now I'm going to attach the syringe into the catheter. Can you get this one for me?
Get on the ground.
Thank you. Then attach it here. So in other institution or hospital, some of the nurses are prefer to test the balloon of the Foley catheter, but for now I'm not going to test it. I'm just going to leave the I'm just going to leave the syringe into the catheter attached. And the urinary bag, which is this one, should be in here. And I'm going to discard this one. And now I'm going to prepare the patient and clean his penis from inner to outer portion. So now I'm going to use my non-dominant hand to touch the penis of the patient. So, sir, gunitan na nako, sir, ha? Kaya nagpiyuhan na nako imuhang ano, sir? Imong penis, sir. Sige, sir. So, at this point, I'm going to hold on like this and raise the penis into a 45-degree angle from the scrotum. And if dili siya tuli, I'm going to retract the penis. I mean the foreskin, but tuli, in this case, tuli man atong patient, so no need to retract the foreskin. So I'm just going to clean it now using my sterile dominant hand and with this cotton balls with betadine solution. So first I'm going to clean the inner to outer portion, then discard. Next, from inner to outer portion, then discard. Next, then discard. And now I'm going to lubricate the tip of the catheter. So now I'm going to insert the catheter into the urethra into 6 to 9 inches or until the urine flows. And insert this one into the urethra of the male patient, of my male patient. So sir, hinga ng malalim, sir. I-insert na nako, sir, ha? And then, I'm going to inflate the balloon to secure the urinary catheter safely and to ensure na dili siya matanggal. Then, discard this one. So now I'm going to prepare the urinary bag. And insert this one in here. Sir, ibutang na ko diri ang catheter, sir, ha? Nurse. So as you can see, I securely attach the tape to the leg of the patient so that ma-secure ang catheter o pag mulihok si patient kay dili lisod ilihok, and also dili siya maglisod o walay infection or retention na mahitabo or any injuries na related sa catheterization. So now, I'm going to attach the urinary bag into the bed, but I must to make sure that na ma-attach na ko ni ang bed, I mean ang urinary bag sa bed, dili sa movable part of the bed, like the rail of something like that in the hospital bed. But for now, wala may movable dirian sa bed na to, so I'm just going to paste it here, and using a plaster para mas safe siya o dili maglisod si patient. O kailangan dili pud dapat duol pud siya sa patient. So as you can see, this is a below the level of the patient's hips. So kung ibutang niyo siya ang urinary bag layo sa patient, dili below level of the hips of the patient, it might cause backflow of the urine and it might cause retention to the patient. So we must avoid that one in order to secure the safety of our patient. So after I connect the distal end of the catheter and the urinary bag into the bed, now I'm going to position the patient comfortably and also gather the equipments that are being used earlier during the catheterization procedure, and discard everything the gamit na dili na magamit. So let's start. Sir, asada may sir, paula na ko ang diaper. Sige sir, pwede na ka mag sir. Paula na ko ng mga gamit. I'm going to discard this one. Kumusta man, sir? Okay lang, nurse. Dili sakit, sir. Dili lang. Maayo. Yes, sir, ano sa ko, sir, ha? Mo, balik lang po niya, mahugas na po ang kamot. Sige. Sige, salamat, sir. Tawagan lang po, sir, kung naa kay mga kailangan. Dayon! Hello, sir.
Hello, nurse.
Sir, kumusta man, sir?
Okay lang, nurse.
Dili, ano, sir, o comfortable ka sa catheter, sir? Sige, sir, maayo na. So, tawagan lang ko, sir, ha, kung sakit ang nakaigibati nga sakit or any na concerns na related sa urinary catheterization or anything, sir, na kailangan ko nimo. Sige, sir. Sige, salamat, sir. Balik lang ko, sir. Sige, nurse. So now I'm going to document everything, and also I will continue monitor the patient until na mahuman ang time sa iyahang catheterization. So, that's all. Thank you. So now I'm going to check the doctor's order. So after washing my hands, I'm going to select the specific type and size of catheter to be used. So in the doctor's order, it is an indwelling catheter. So now I'm going to get the Foley catheter. So for the equipments, I prepared already my equipments needed. So I have here a cotton ball, surgical gloves, Foley catheter, drainage bag, waste receptacle, betadine solution, easy lubricating jelly, a drape for the patient, which as I prepare it and maintain the sterility of the drape, and kidney basin, medicine tray, and also a forceps tray. So now let's start and meet the patient.
Dayon!
Hello, ma'am.
Hello!
Good afternoon, ma'am.
Afternoon.
Ma'am, ako si Hannie Rellon from Brokenshire College of Davao. Ako ang imuhang nurse sa karon, ma'am. Okay lang sa imuhang, ma'am?
Okay lang.
Okay, ma'am. Ma'am, pwede na ako mabala nimong pangalan?
Ako si Susan Rellon.
Kano sa kanimong birthday, ma'am?
June 3,
June 3.
1966.
Pila na imong edad, ma'am?
54.
54. Mana ba kang ligo, ma'am?
Yes, ma'am.
Sige, ma'am. Sa karon, ma'am, mag-perform ko og catheterization. I-catheter ti ka, ma'am. Kay, mo man na ang order ni doktor sa imuha. Since dili naman ka makaadto og CR para mumihi. So, Ang order sa doktor, i-catheter daw tika para dili na ka mag-adto CR o kanang able ka makaihi nga bisan naa lang ka diri sa imong higdaanan. Okay lang sa imong ma'am, padayon ko.
Tikang ka ko.
Oo, tikang ka karon pero i-assist lang tika ma'am.
Sige.
Sige ma'am, magsugod ako ma'am ha.
Sige.
Sige, salamat ma'am. So sa karon ma'am, saradaan ako ning ano ma'am ha, cortina to provide privacy. Uy. And ma'am, i-assist lang tika ma'am na pina-dorsal recumbent imong position. Paon ako ni ma'am. Ni ma'am, langkat pagamay na mga bend lang gamay ma'am. Ana, tapos sa pikas ko. Ana. Sige ma'am, mag-prepare sa ako sa gamit ma'am ha. Sige ma'am. So now, ibutangan ako ang diaper sa baba sa patient. Ma'am, pwede ko paan sa gamay, ma'am. Thank you, ma'am. And now, I'm going to wear my gloves. And carefully not to touch the sterile area in the gloves part. And then, discard this one. After that, I'm going to put the second drape into the patient's perineal area. So the rationale behind that one is to provide more sterile area. And now I'm going to clean the private area of the patient. So I'm going to use this cotton ball with betadine solution, and I'm going to clean first the inner to outer portion. Ma'am, limpyuhan na ako, ma'am. So this is one side only. Next. Then discard. Next is into the center. Then discard. After that, I'm going to prepare the catheter into the sterile field. And now I'm going to insert the injection with 10 cc sterile water. In some institution, they prefer to test first the balloon, but for now, I'm not going to test it. So, I'm going to proceed into putting this catheter in lubricant easy jelly, and then I'm going to use my non-dominant hand to touch the meatus of the patient. Ma'am, kapo na ako, ma'am.
Wow.
Ma'am, hingang malalim. So now, I'm going to insert now the catheter into the patient.
into 2 to 3 inches. After that, I'm going to inflate the balloon. And then discard this one. After that, I'm going to put or insert the urinary bag. Kumusta ma'am? Dili sakit ma'am? Sakit. Tama naman ma'am. Ma'am, ibutang na ko ni urinary bag diri ma'am ha. So using this plaster or marcator, I'm going to attach the urinary bag here beside the vagina.
Itai. So, I do this to secure the urinary bag na dili siya matanggal dayon o dili siya mahulog or maunsa man kung maglihok-lihok ang tiil sa pasyente.
And sunod ato, I will put this urinary bag here below the waist level of the patient. Dili kay siya layo or dili dapit sa breast or dul dapit sa tiil, sa tumoy, no? Dili pwede because we are here to the safety of our patient and as a nurse, dapat ma-avoid nato ang retention and any infection or backflow sa urine. So, I'm going to put the urinary bag here below the patient in waist level of the patient. And also, in the hospital, dapat dito adyo siya sa part na dili, kanang movable. Because, pag movable siya, dali lang matarog pag magliho si patient. So, iwasan nato na. So, I'm done. After that, I'm going to clean my area and wash my hands. And also, I'm going to disregards all the unnecessary things like disposable materials. I'm going to dispose it and clean the non-disposable materials. Ma'am, manghipos na ko, ma'am. Mana ko, ma'am. Kumusta, ma'am? Okay lang, ma'am. Comfortable ka sa catheter, ma'am. Ma'am, ansa lang gamay, ma'am. Ayun, hindi pakita mo. Sige, ma'am. Pwede na ka mag-ano, ma'am. Anak. Ma'am, relax lang, ma'am. Okay na ka, ma'am? Okay na. Sige ma'am, kay magbalik lang po niya ma'am, ano lang po, balikan ti ka o i-assess kung unsa na ang sitwasyon sa catheter sa imuha o i-report lang po sa kuha ma'am kung nakay na feel na mga pain or sakit sa related sa procedure na tulibuhan ti ganina or unsa man ang mga concern nimo about sa catheterization or naa pa kay kanang sakit ba imo sa sulod ma'am or what, iinga lang ko ma'am and ma'am hipos ako ma'am tapos ma'am hugas ako kamot balik lang ko niya ma'am. Sige ma'am, salamat ma'am.
Salamat.
Ayun.
Hello, ma'am.
Hello.
Hello, ma'am.
Ako tong nurse ka ganina ma'am, si Hannie Rellon. Ma'am, kumusta man ang catheter ma'am?
Wala mo kong gibati, day.
Wala kay gibati. Okay lang siya ma'am?
Okay raman, ma'am.
Okay lang, sige. Sige ma'am, ina lang ko ma'am kung naa kay mga kailangan ma'am or mga pain na gibati. Okay lang ma'am?
Okay lang.
Sige ma'am, mubalik lang po niya ma'am ha. Sige, salamat ma'am.
So now I'm going to document everything, and also I will continue monitor the patient until na mahuman ang time sa iyahang catheterization. So that's all. Thank you.